So your provider says you need a labor induction, but what does that actually mean? Let's break down what to expect when you are being induced for labor. First things first, what is a labor induction? Basically, it's a medical intervention to start your labor instead of it occurring all on its own. Common reasons for a labor induction include post-term pregnancy, like 41 or 42 weeks, high blood pressure or preeclampsia, concerns about baby's growth, or your water breaks but there are no contractions. So let's get started. Step 1, cervical ripening. Your cervix isn't soft and it isn't quite ready yet. So there are usually two options that doctors and midwives go for. One is a medication to soften and thin the cervix. The other is a Foley balloon or a Cook catheter, and that's inserted in to basically apply pressure to the cervix, which will start some contractions. Now, this can take several hours, and it could last overnight. It just depends on what's going on with your specific birth. Step 2, we're going to want to start some contractions. A few ways they're going to attempt to start those contractions are going to be Pitocin, or a synthetic oxytocin. It's given through an IV and it stimulates contractions. They could try a membrane sweep, and it's a manual stretch of the cervix. They're hoping it releases hormones that will start your contractions. And they could try breaking your water. If that bag of water breaks, baby's head is now directly in contact with your cervix, thus stretching it, widening it, and causing contractions. On to step 3, progression. Contractions are going to intensify and they're going to keep boosting up that Pitocin number. Yay! This is going to require monitoring. Fun. This may also cause your contractions to become unbearable. You're going to want some sort of kind of pain management at this point. That can be laughing gas, that could be IV medication, that could be the epidural, but usually that's what happens next. Now, what they won't tell you is that an induction could take a couple of hours or it could take a couple of days. And then step 4, finally, we get to the birth. Once you're fully dilated and effaced, it's time to push. But depending on your circumstances and your journey, labor may stall, or maybe baby's in distress. They will start to discuss interventions, forceps, vacuums, C-sections. It just depends on your labor, your delivery. Things to know about inductions. They don't always work the first time. They can, and usually do, lead to worse contractions. And there is an increase for a C-section, but many people still have natural births. I say all that to say, don't forget to advocate for yourself. Ask about all of your options before agreeing to something. Request the lowest dosage of Pitocin before you start, and you can always tell them to turn it back down if it gets too high, or to turn it off. And if you can move around, move as much as you can. And take advantage of that breathing and those comfort measures to try to keep you calm, or as calm as you can be. Inductions can feel overwhelming, but at least knowing what to expect makes a huge difference on the experience.